Normal CO2 level in the blood. Option A 40 to 50 mm of Hg. Option B 35 to 40 mm of Hg. Option C 25 to 50 mm of Hg. Option D 30 to 50 mm of Hg. The correct answer is option B 35 to 40 mm of Hg. The partial pressure of carbon dioxide in the blood is 35 to 45 mm of Hg, and partial pressure of oxygen is 80 to 100 mm of Hg. Bicarbonate level is 22 to 27 milliequivalent per liter, and pH of the blood is 7.35 to 7.45. Next question is surgical timeout is dash measure. Option A relaxing, option B infection control, option C delaying, option D safety. The correct answer is option D safety. This is a surgical safety checklist. The WHO published surgical safety checklist in 2008 in order to increase the safety of patient undergoing surgery. WHO surgical safety checklist divided into 3 sections. The first is sign in, second is time out, and third is the sign out. Sign in to be completed before the induction of anesthesia in the presence of anesthetist. Time out before the skin incision. Sign out completed before the patient leaves the operating room. Next question is the indiscriminate oxygen therapy for a premature newborn can lead to option A glaucoma, option B cataract, option C ophthalmic neonatal, option D retrorenal fibroplasia. The correct answer is option D retrorenal fibroplasia. Retrorenal fibroplasia, also called retinopathy prematurity and Terry syndrome. This is a disease of the eye affecting premature born babies receiving high oxygen concentration for long period due to premature development of their lungs. It is caused by disorganized growth of blood vessel in the retina, which may result in scarring and retinal detachment. Which one of the following is water soluble vitamins? Option A vitamin A, option B vitamin C, option C vitamin D, option D vitamin K. The correct answer is option B vitamin C. Vitamin A, vitamin D, vitamin E and K are fat soluble vitamins, can be stored in the body, and so the excess can cause toxicity. Vitamin B and C are water soluble vitamins, are not stored in the body and can be excreted through the urine. Option A nasal intubation promote. Endotracheal intubation through oral is preferred to nasal intubation because the question asking is why oral intubation is more preferred than nasal intubation. Option A nasal intubation promote sinusitis and block sinus outflow. Option B it is more convenient for intubation. Option C easy for endotracheal suctioning. Option D it is more comfortable for the patient. The correct answer is option A. In nasal intubation promotes sinusitis and block sinus outflow. A mother of 6-year-old child with type 1 diabetes informed the nurse that child appears sick and urine is positive for ketone bodies. The most appropriate instruction to the mother is option A hold the next dose of insulin. Option B, come to hospital immediately. Option C, administer an additional dose of insulin and take rest. Option D, encourage the child to drink calorie-free drinks and bring the child to hospital. The correct answer is option D, encourage the child to drink calorie-free drinks and bring the child to the hospital. Next question is, in a patient with decorticate posturing, the nurse observes. Option A, flexion of elbow, extension of knees and plantar flexion of feet. Option B, flexion of upper and lower extremities. Option C, extension of upper and lower extremities. Option D, extension of elbow and knees and flexion of wrist. The correct answer is option A, flexion of elbow, extension of knees and plantar flexion of feet. The decorticate posturing, and this is the decerebrate posturing. The posture is flexion and decerebrate the posture is extension. In decorticate, the patient flexes one or both arms on the chest and plantar flexion of the feet. In decerebrate, the patient extends the one or both arms and legs. For a comatose patient, the highest priority nursing diagnosis is option A, altered sensorium. Option B, ineffective airway clearance. Option C, impaired physical mobility. Option D, altered nutrition. The correct answer is option B, ineffective airway clearance.